I will speak about hydronephrosis. There is what? There is distension, dilatation of the renal pelvis and calyces. So here there is what? There is distension, dilatation of the renal pelvis and calyces. So usually caused by what? Urinary tract obstruction. So there is obstruction of the urinary tract by what? By the renal stone, or severe benign prostatic hyperplasia. Benign prostatic hyperplasia. There is benign prostatic hyperplasia leading to accumulation of urine inside the urinary bladder, leading to accumulation in the both ureters, right ureter and left ureter, leading to bilateral hydronephrosis. So there is renal stone that will cause what? That will cause ureter obstruction, leading to hydronephrosis, or severe benign prostatic hyperplasia leading to bilateral hydronephrosis, or congenital obstruction, or locally advanced cervical cancer. What is cervical cancer? Cancer from the cervix extending to the right and to the left, and to the left. So there are two ureters. This is the left one and this is the right one. So this is the cervix. So extension of the cancer bilaterally leading to obstruction of both ureters, the left ureter and right ureter, leading to bilateral hydronephrosis and renal failure and death. So this is so important. So cervical cancer, cervix extension bilaterally leading to obstruction of both ureter, leading to bilateral hydronephrosis, renal failure and death. Then injury to ureter. If there is injury to the ureter, leading to what? Distension and dilatation of the renal pelvis and calyces. So it's caused by what? By urinary tract obstruction, by stone, severe benign prostatic hyperplasia, congenital obstructions, locally advanced cervical cancer, which is so important. Injury to the ureter, leading to what? Leading to stenosis, fibrosis and stenosis of this ureter, leading to obstruction and dilatation, distension of the renal pelvis and calyces. Other causes include what? Retroperitoneal fibrosis. Can affect the ureter, can affect left ureter or right ureter. So leading to what? Leading to hydronephrosis. Then vesico-uretral reflux. What is vesico-uretral reflux? Vesico means what? Urinary bladder, uretral, so from the ureter. So there is reflux from the urinary bladder into the ureter. So vesico-uretral reflux leading to distension and accumulation of the urine inside the kidney, leading to hydronephrosis. Dilatation occurs proximal to the site of pathology. So serum creatinine elevated in case of what? Bilateral, and maybe in only one obstructed solitary kidney. So bilateral, or maybe obstructed solitary kidney. If there is obstruction in solitary kidney, then leads to what? Compression and possible atrophy of the renal cortex and medulla. This means what? If there is obstruction here in the ureter, there is accumulation of the urine, leading to distension of the kidney and distension and dilatation of the renal pelvis and calyces. This distension and by compression of accumulation of the urine, compression on the renal pelvis and calyces, leading to what? Atrophy of the renal cortex and medulla. Atrophy in renal cortex and medulla, leading to what? Blunting of the renal pelvis and calyces, blunting of the calyces. Then the next one, urinary incontinence may be mixed incontinence of what? Of stress with urgency. So we will speak about the causes here, the causes of urinary incontinence. So the first one is what? Stress. The second one is what? Urgency. The third one is overflow. So stress. So from this image, there is stress on the urinary bladder with hypermobility or deficiency of intrinsic sphincter here. So there is what? There is hypermobility of the urethra, or deficiency in intrinsic sphincter with increase stress over the wall of bladder, leading to what? Stress incontinence. So outlet incompetence of outlet because of what? Because of hypermobility of the urethra, which is so important. This is so important. Hypermobility of the urethra, or there is deficiency of intrinsic sphincter, leading to dribbling of urine and loss of urine. So there is a stress. This is the main one. There is a stress in case of what? Increase intra-abdominal pressure, like what? Sneezing or lifting heavy objects, or sneezing, leading to increase intra-abdominal pressure, leading to stress on the wall of the urinary bladder with hypermobility of the urethra, and deficiency of intrinsic sphincter, leading to dribbling of urine, loss of urine. Then positive bladder test is what? You will ask the patient to cough or Valsalva maneuver. What is Valsalva maneuver? Expiration against what? Against closed epiglottis. So expiration, exhale against closed epiglottis. So coughing or sneezing, or Valsalva maneuver by expiration against what? Against closed epiglottis, or exhalation against closed epiglottis, leading to what? Leading to leakage from the urethra. So it's called the positive bladder stress test. So association with what? With obesity. Why? Because there is increased compression by increasing in the weight, increasing in body mass index, leading to compression and increase in intra-abdominal pressure, compression on the abdomen, leading to more stress on the wall of the urinary bladder. Then what? Pregnancy. There is what? There is fetus. This fetus will increase the intra-abdominal pressure, leading to more stress on the wall of the urinary bladder. Vaginal delivery. Why? Vaginal delivery will cause weakness in pelvic floor muscle, leading to urethral hypermobility, and may lead to deficiency in intrinsic sphincter, leading to dribbling of urine. Then prostate surgery. If there is surgery in the prostate, can lead to dribbling of urine under any stress. Then the treatment will be what? Pelvic floor muscle strengthened by what? Kegel exercise. This is so important. So Kegel exercise to strengthen pelvic floor muscle, plus what? Weight loss to decrease the abdominal pressure, plus pessaries. What is pessary? Pessary is a device that the doctor will insert into the vagina, leading to support of prolapse of organ, support the prolapsed part. So you will use pessaries. So Kegel exercise, weight loss, or pessaries. Then the second type is called what? Urgency incontinence. Means what? There is detrosal muscle overactivity of the detrosal muscle. So there is leakage with urge to void immediately. So the patient will feel that he wants to void immediately, but while going to the bathroom, there is leakage of urine. Why? Because there is detrosal overactivity, leading to dribbling of urine. So in case of what? UTI leading to what? detrosal hyperactivity, overactivity, leading to loss of urine, leakage of urine, with urge to void immediately. So you will treat it by what? Kegel exercise, so important. Kegel exercise to strengthen the pelvic floor muscle, plus what? Bladder training. So voiding in a specific time, so it's called the timed voiding. Then distraction or relaxation techniques, while the patient feels he wants to void immediately, so he will use what? Distraction or relaxation technique plus voiding in a specific time, so it's called the timed voiding. Then Kegel exercise to strengthen the pelvic floor muscle. Then the main two drugs we have antimuscarinic called oxybutynin or mirabegron, which is beta 3 agonist. It's called mirabegron, antimuscarinic, oxybutynin. So these two drugs are so important. So you will use antimuscarinic in cases of what? In case of urgency incontinence. You will use what? Antimuscarinic to decrease the contractility of the detrosal muscle, or you will use mirabegron, beta 3 agonist, mirabegron. Then the third one, overflow incontinence. What's meant by overflow incontinence? There is incomplete emptying, incomplete voiding, leading to what? So there is detrosal underactivity or outlet obstruction, leading to accumulation of urine inside the urinary bladder. This accumulation of urine will compress against the wall of the urinary bladder, leading to overflow means huge amount of urine inside the urinary bladder, leading to what? Leading to dribbling of urine, loss of urine. So there is incomplete emptying, or incomplete voiding. Why? Because there is detrosal underactivity, or there is outlet obstruction, leading to what? Leak with overfilling means what? It will begin with incomplete voiding, leading to accumulation of urine inside the urinary bladder. This is called overfilling of urinary bladder, or it's called overflow, leading to sudden loss of urine, dribbling of urine. So there is leakage with overfilling of urinary bladder. So how to know it? By catheterization or ultrasound. You will find a huge amount of urine inside the urinary bladder. Or catheterization, you will know what? You will know post-voiding, increase in post-voiding residual volume. So increase in post-voidal residual volume. This means what? After voiding, there is incomplete what? There is incomplete voiding. So after voiding, post-voidal residual amount of urine. So there is increase in the residual urine after voiding. So there is incomplete voiding, because there is increase in post-voidal residual volume. In catheterization and what? Ultrasound. Then cases of what? Polyuria, like diabetes. There is diabetes mellitus, diabetes insipidus, and both of them there is what? There is polyuria, loss of water, polyuria, then bladder outflow, outlet obstruction, like what? Benign prostatic hyperplasia here, leading to incomplete emptying, incomplete voiding, spinal cord injury. Why? Spinal cord controls the urinary bladder. So if there is injury, so there is loss of control of the urinary urinary bladder, so there is a decrease in voiding, so there is accumulation of urine inside the urinary bladder, leading to distension of the urinary bladder and overflow. This overflow leading to dribbling of the urine, then the treatment will be what? Catheterization to decrease the amount of urine inside the urinary bladder, then relieve obstruction. So if the cause is benign prostatic hyperplasia, relieve it by giving alpha blocker for benign prostatic hyperplasia if it's the cause of overflow incontinence, so you will give what? Alpha blocker.